Hi there, in this video I'm going to be showing how to fill in the baseline T1 assessment for any patient on the eDerma system. So first things first, you want to go to the top of the page and then find your patient. So for this example I'm looking for patient test. And once I click test into the top find patient search, I get two patients. I got test 1 and test 2. Now just ensure that you get the correct patient, their name, their date of birth and their study number. So this could be all different in all the different locations, so just ensure it's the correct one. So for this one I'm going to go with PRIMM 100, which is test 1. Now once you open the patient you can see all the information about the patient, and on the right here you have all the options. Now you can see this new PRIMM T1 assessment, but if you click on the drop down you can see the T2, the 3, the 4, 5 and then so on. But for this video we're just going to be showing you the T1 assessment. So we can go ahead and just click on new PRIMM T1 assessment. Now you can see that we're adding a new T1 assessment for our patient test 1. You can select the consultant, select the location of where the patient is. So these are all the hospitals that are involved in the study. You can say the visit time and then just ensure all the inclusion criteria is met, and you can simply click on it. And if there is any exclusion, you can simply click on it. Now this is an exact copy of the questions on the paper ones, but it's just in a slightly condensed format, just to make it a lot simpler and a lot faster to enter it. Now if you see on the right, you can see melanoma classification. So we have the three options here, and then the date of the diagnosis, should you know it, and then any thickness, you can type in the numbers. If it's ulcerated, you can tick the box melanoma site. Now this is just searching for location, so if you know it's on the hand, you can just type in hand and it will give you all sort of options for hand, for example. And then again, metastasis, if they've had central node status, any BRAF status, the ECOG score, you can just drag up from 0 to 5, that's nice and easy. Any previous treatment, if it's not in these options here, you can then just type from the list. Now, if you know their planned immunotherapy, you can then click on the boxes. Sometimes it can be multiple or not, so that's nice and simple. You get down to the consent, and this is add new consent. You click on the purple box, and this is essentially just confirming that the patient has physically signed on the paper sheet. So the system can also reflect what it has. So you can just say it has been consented and click create consent, and you can see that it's saved. Now in the research assessments, you can just make sure that they've done or had been given the questionnaires, i.e. the food frequency, the baseline GI questionnaire, and then have they been given a sample kit to fill in at home, and were the bloods taken, for example. So if you know them, you can then tick them. If some of them you don't know, you can just leave them and then enter them later when you know that they have been done. That is absolutely fine. Medical history, again, is very simple. The hot ones are sort of available to click, but if there's anything here, you can just search for anything in the box, for example, and it will come down. So let's say we've gone for DVT, you can then just click on all the options. Any allergies, this is very, very simple. You can type anything from drugs to foods, for example. So the one I like to demo is allergy to peanuts. That's nice and easy. Physical details, it's default in kg, but should you wish to use other units, you can change that. So we can then just put something like that, for example. Notes, these are the free text that you can just add. Quite handy if they've got any other notes or anything that you think is very important to note down, which is not given in the options. Now the results, we can add any of the results: blood, CT, head, MRI or tumour biopsies. So if we just wanted to add blood, you select the blood, you go add new result, and then you can then just put any of the numbers here that are correct. Again, these are just fully example numbers. And once you've added all the information, you can create result and you can edit it if you've made a mistake, for example. And then again, if you want to do a body CT, you can add new result. And you can say the side, the site, and the size, for example. So that is nice and easy. Now, the final bit is the medication. Now this goes exactly how you used to see it in the form. So it goes the drugs, the regimen, dose, unit, route, start date, and end date and indication. So for example, nice and easy, if we go for paracetamol, we can say regimen, they were on it twice a day, and the dose is 1 gram, and then the route orally, and they started on the 1st, and it's still ongoing, for example. But if you want to add another one, just simply click on add new medication, and the options come back again. So you can just start to type anything that you want, and then again it's the same option, so it's nice and easy. And the final question is just if you can confirm that you've done all of this in accordance with the protocols and everything is correct and truthful. Now the final option is you have the state to save this assessment as. You can save it as pending, which means that you can come back in any time and edit, which is quite important at the start because you may potentially be waiting for blood results or CT scans, for example. Or if you're happy that everything is done, you can say completed. And if you're happy, well, if you would like it to be withdrawn, you can withdraw it, and you can also cancel it if you've done it in error or this is the wrong patient, for example. But I would just suggest to start it as pending until you have all the information, and once you're happy, you can then lock it away. Because once it is completed, it cannot be edited, you see. So if we go ahead and click save as pending, you will then see that it goes green. If you've done anything wrong, for example, it will always tell you. So if you've missed any mandatory information, it will tell you you've just missed this and gone red. But as you can see, it's gone green and it's all been created. So now if we go back to the test 1 patient, you can see here in orange that the PRIMM T1 assessment is there and it's saved. If we click on the eye, you can see all the drop-down menus. Should you wish to get a PDF printout, you can click on this PDF printout and it will take the whole assessment and put it into a nice PDF for you, and then you can slot it in the notes if that speeds up things for your clinical admin. And again, if you want to edit anything at any time, so long as it's still in the pending state, you can click edit and then say we would like to put some new head MRI results. You can just click on there, add all the results, for example, and then again click save. So it's a very, very handy tool, and that's how to do the baseline study. Thank you very much.